We want to make sure that we're separating fact from fear when it comes to the coronavirus, and that's why we've been bringing in several experts over the last few weeks to help answer whatever questions you have. Today we have Dr. Bruce Swords, the Chief Physician Executive at Cone Health, with us. He'll be here until 6 o'clock tonight to answer your questions. What you need to do is text your questions to 336-379-5775. That number is on the screen right now. Remember, this is a text of a question. This is not a call, but a text of a question. All right, Dr. Swords, let's get right to it because we have lots of texts already. The very first question is, can mosquitoes transmit the coronavirus?
It's a new question for me. I am not aware of any transmission via mosquito bites.
Gotcha. Okay. And we might have to just wait on that one to see if there's any more studies or anything on that. In the meantime, someone is asking, can people who die of coronavirus, can they still be organ donors?
So I'll take a stab at this. I don't know the absolute facts. I would say that people who die of an infectious disease are generally, if not exclusively, excluded from being an organ donor. So it would be very unusual, I think.
Gotcha. I think that's probably on top of mind. People are thinking it's on their driver's license. They've signed up and they want to know if that's going to be the case or not. All right. This is the subject of the day. It's about masks. And it says, how important is it for people to wear masks outside or when they have to go to the store? I can't find any in stores, so I haven't been wearing one. How dangerous is it to not wear a mask?
Masks are a big topic of conversation everywhere. In the community, for sure, there have been recommendations for masking. And I just want to remind viewers, listeners, that masking is important to protect others from you, not to protect you from others. And so the idea is if you have a mask on, breathing the vapor from your breath doesn't transmit into the environment the way it would without a mask. Breathing through a mask, there's so many ways for air to enter, not through a filtering system, that masks are not thought to be useful to prevent us from getting an infection. It's to prevent us from transmitting the infection.
Gotcha. And I understand, especially since over the last couple of days, since that recommendation came out, some people have been misunderstanding it, thinking that they have to go buy a medical grade mask. And what the recommendation for was just some kind of face covering.
You're right. And so anything from a scarf to a cloth mask, there are some fabric masks that are sold in stores. And any of those are thought to help protect us from transmitting our potential COVID to somebody else.
Gotcha. Okay. So someone is asking, if someone with asthma gets coronavirus, would they be sick longer than a person that did not have asthma?
The duration of the illness might not change dramatically. The severity of the illness could change significantly. It is thought that people with asthma have one of these, quote, comorbid conditions, end quote, that make coronavirus or COVID-19 more dangerous. And so people with asthma should certainly, like the rest of us, take extra precaution around hand hygiene, staying away from people. It's not so much the duration, it's the intensity of the illness that would change.
Gotcha. Okay. Now, this is something that we've been hearing over the last 24 hours, how the next 2 weeks is really critical. And so this person is texting, can you tell me why the next 2 weeks is so critical?
If you listen to news, especially national news, you have heard or will hear that this week will be the worst week ever. And so I'm not debating that. It's likely true. And what makes it worse and what we should expect over the next couple of weeks are folks who were infected with the virus last week are going to get ill this week or next week. And it's the volume of patients who have the illness that will make the next week, 2, 3 worse.
And so the thought then is, if we are thinking that that could be possible, the best thing for you to do is really to stay at home and not be in those different places that maybe you have been going.
The one thing that we know works is staying at home and staying away from people. This virus is transmitted person to person through respiratory droplets or respiratory mechanisms most frequently, and the way to avoid that is to stay away from large crowds and people. It's all about distancing yourself physically from people.
And again, I think people were hearing, don't go to the grocery store this week. And I think the message is more of, don't be going to the grocery store 3 and 4 times because you're forgetting stuff. Make a list, do it once, and limit your exposure.
That's right. It's all about essential services. So we all have to eat. We all have to go to the grocery store. There are other things that we have to do. So do them once and do them right, and don't go back.
With that in mind, one last text question before we head to break. This one asks, can the virus live on produce at the store, and should I wash it or do something with it?
It's probably good practice to wash produce no matter what time of year. Pesticides and other items that we don't want to ingest could be on produce. So yes, now maybe more than usual, wash the produce. And after you handle produce, make sure you wash your hands and perform appropriate hand hygiene. Every grocery store I've been in, not that I've been in very many, but you will see hand sanitizer everywhere.
With that, can plastic gloves be reused if you wash them?
You can, so plastic gloves, latex gloves can be reused. They're sort of a hassle, and yes, wash them. If you run out of supply and you want to use gloves, it would be okay to wash them.
Okay, and when are we talking like the 20-second wash like we do with hand washing? We throw them in the washing machine.
Not the washing machine. You're talking about washing your hands, and they really aren't appropriate for hand sanitizer. Some of the hand sanitizer could disrupt latex gloves.
Gotcha. Okay, what we're going to do is we're going to take a break right now, but we're going to get to more of your text questions as we come up.